Hello everyone, it's Christy here from Cigna Hong Kong. My great pleasure to join you guys in the Venture Capital Forum today to share with you my views in terms of employee retentions and how healthcare provisions could add values on it. So just a little bit of background about myself. So my whole career is in HR across different industries in legal, banking, insurance, and asset management field. So I have the honor to work in the Hong Kong market, Asia Pacific market, with my last role in London with HSBC Global Management Business. So you see my specialties in HR that are across different functions that you see with business partnering, employee wellness, compensations, etc. So given my interest is actually on people, I have particular interest in terms of driving people strategies to support the business growth. So many people ask about what HR actually do. Very simple. You see that is talent acquisitions, talent development, and talent engagement. Particularly with the experience in Cigna, our employee value propositions specifically focus on empowerment, agility, and personalization. So hopefully throughout my presentation today, you can see how these values are actually embedded in our people strategies. So before I go on, a bit of background about Cigna Corporations. We are global health insurance companies, ranked 13 of the 2021 Fortune 500 list. So we have a 1.5 million relationship with healthcare professionals and also 180 million customer relationship across the board. In simplicity terms, we provide healthcare solutions to individual business and also to group clients. We provide both local health solutions and also the global health solutions. Our mission is to provide affordabilities, predictabilities, and simplicities in terms of all the healthcare plans for our clients. So given this topic is so focused on people, let me quickly introduce my audience today. Can I ask the first poll on a relatively personal questions to understand your stress level? Can I get this first poll, please? So the first question is to briefly understand what is your major cause of stress. So we did provide a few options here for you to vote. Maybe just give another 30 seconds to see what will be your response. Okay, great. The responses are coming, so a couple more seconds, please. Okay, so I think it's about time. So you see the results here. So now, despite I didn't see you all, I kind of know that your major cause of stress is around too much work in terms of your family finance. Okay, some more results coming, the uncertainty about the future. Okay, so these are the top 3 areas that you guys have chosen. The story is you're not known. This survey is actually, your survey result is actually very aligned to the presentations that I'm going to share with you later on. Can we go back to the presentation slide? Okay, so the reason I asked about your stress level because I want to share with you this Cigna 360 Wellbeing Survey that we have actually conducted in the past 7 years. So we spoke to 80,000 people across different markets. Hong Kong is one of the markets that we invited for respondents, and we look at the well-being index across family, financial, physical, social, and work perspectives. So in our recent result, we actually surveyed it in April time, with a result published in June time. So you can see that these are the top 3 areas that we have retrieved through the survey. So the first one, very aligned to the response that you shared with me just now, that many of the respondents are actually quite concerned about the longer-term financial commitment. It could be their current financial situations, or in terms of the uncertainties that they need to deal with. For the longer financial commitment, it would be mortgage, family, education, etc. The second findings that we have realized is employees actually now expect more health and well-being support from the employers. So it will be a bit different from what we used to think that it would be salaries, bonus that attract people, but actually people expectations has kind of been changing that expect like more support from their employers. So the third findings that we have is mental health is actually seen as a most important influence on health in terms of whole person health. So again, like mental health used to be more like a stigma in the society, but now the awareness is actually increasing. So to zoom into the survey result, we realized that Hong Kong people actually has the second highest stress level among all the different markets. So given the stress level that you showed me just now, I think this result isn't that alarming, it isn't that surprising. And also, among the respondents, these are the top 3 areas that they have stressed about, which again, very aligned to what you just shared with me. The top 3 sources of stress would be uncertainty about the futures, the first personal finance, and also contracting about COVID-19. So these are the top 3 findings that we have noticed. Then, given this topic about employee engagement and also employee staff retentions, other than knowing the top 3 results that we have just now, I think you would be interested to hear more from me about the employee expectations. So given the situations, what support the employees are actually expecting from the employers. Then it comes to the second poll questions. So I would like you to think about being an employee, when you were an employee, what were the top 3 supports that you were looking for from your employers? Or based on your understanding or yourself as an employee, what are some of the support that you're looking for? Okay, let's have another 30 seconds maybe. Okay, I see that some more responses are coming, so maybe just another 10 seconds for that. Okay, so the voting is now closed. So let's look at the result. As an employee or in your understanding, you believe that your employees or yourself would actually look for flexible working arrangement, healthcare coverage. Okay, very good, like the mental health support, like many of you actually did indicate that. And then follow with the digital friendly supporting tools, career development tools, and family support, etc. Okay, great. So again, your response is very aligned to what I'm going to share with you in terms of the other findings that we noticed. So again, through the survey, we asked specifically the respondent on what are some of the support that they're expecting that their employers to provide to them. So we noticed, given COVID-19 in the past 2 years, people actually have been reassessing their priorities, that health, well-being is something that's top of their mind. So according to the response that they provided, they're actually looking for enhanced health insurance coverage. They're looking for virtual health consultations. It could be like telehealth or apps that they can get medical advice. And also they're looking for the employer to provide more support in terms of the mental health. So you see that this slides here, we show that what are the expectations from the respondent versus the reality. Reality meaning like to what extent the employers are currently providing that kind of support. So you will see that the gap is actually quite wide there, like 56 versus 20. So there are like 36% of gap that employers is not yet providing the enhanced health insurance support to the employees. So you see the gaps is actually across all locations. And also, the gaps is actually wider in Hong Kong than in other locations. So given there's such a wide gaps, we see that there's a great opportunities for the employer to actually fill the gaps. And then another findings that we notice, mental health is now seen as the most important influence on whole person health. So again, throughout the respondents, we noticed that the people actually indicating that like they really want the employer to look at them as an individuals. They want more support in terms of work-life balance. That again quite correlate to what you did indicate just now in terms of flexible working. And also they look for employers to understand them and care about them as an individuals. And also they look for more support in terms of apps, tips, and advice on their physical as well as like emotional health. So you see that the mental health, again, has become quite an important topic, and the general awareness has been much wider. So now, I would just quickly conclude all the survey results that we have received. So again, you see that the stress level in Hong Kong undeniably is really high across all the markets, and quite a lot of people find it very difficult to manage all this stress. And among all the sources of stress, it's noticed that the uncertainty about the futures, their financial implications, would be two of the biggest areas that people are concerning. But the silver lining is that people's mindset has been changing. They are very focused on their own health and well-being, and they are looking forward for the employer to provide more support to them. So hence, as an employer taking the driver's seat of the organizations, there's definitely room for you to provide support to your employees. So now, after we go through the survey that we have conducted in different markets, and also we look at the results specifically for Hong Kong, I don't want to be too academic and keep talking about the survey. Going forward, I'm going to share with you the specific experience that Cigna have run through in the past 2 years. So before I go on to talk about the story in Cigna, I would like to share a bit more context to you in terms of why we do what we do. So apparently Cigna will have undertaken quite a lot of people strategies to enhance people well-being, to enhance their engagement, and then to retain our staff members. Hence, I'm really keen to share with you some of the solutions that we have been tested and piloted in the past few years. What are some of the expectations from the employees? What have been changing in the past 2 years with COVID-19? And also, what are some of the learnings and observations that Cigna have gone through, so that maybe you can take some reference from. Allow me to give you some background in terms of the situation of Cigna Hong Kong that we have to deal with in the past few years. So firstly, Cigna, despite we have a very strong, long history in Hong Kong, we have been undergoing quite a drastic business expansion in the past few years, that we have been refocusing on a business in terms of healthcare provisions. So as HR, the number one topics that I need to deal with is how to have the talent on board to support the business expansion. So in your mindset, maybe Cigna as a healthcare and insurance companies, the talents that you have in mind were probably the traditional insurance talent, be it in sales or actuarial, etc. So the story for Cigna is slightly a bit different. We had this business expansions with a mindset for being a health services company. Hence, we were looking for talents across different industries. We did look for health professionals, being registered nurse, doctor, to join our team to provide the healthcare services. We also look for the technology expert, data scientists, innovative individual, so as to support our InsurTech capabilities, to support our innovations, to support our data science kind of work. So in short, I was given a situation that I need to look for talents across different industries to join Cigna to support the business growth. Of course, in the past 2 years, there are continuations of COVID that actually add on to the burden to support the business strategies. And understandably in Hong Kong, that I believe is the situations that you guys are encountering now, which is a very severe talent war, that there are loads of opportunities in the market, there are limited talents. So how do I actually attract all these talents to join Cigna? And back then, the employer brand of Cigna is relatively weak, given we were entering the market, we were a bit premature, and our brand wasn't as strong as some of the big players in the market. So how to increase the employer brand awareness and how to have a differentiated employer value propositions with some of the situations that I need to deal with. So I hope it may be some of the situations that you guys are dealing with as well as a startup, that you're building a brand, you're looking for talents, and then you need to compete with some of the strong players in the market. So these are some of the situations that Cigna used to deal with as well. And then the last 2 points is more like being Signal. We said that we look after the well-being of our customers, of our members. We're keen to see how do we live our brand promise, how to make sure that our employee actually align with this promise and also they share the same purpose and visions with us. So these are some of the contexts back then that as HR we need to deal with, and hence it explains like what are some of the solutions that we try to employ. So I started like doing with all these situations. There are loads of people strategies that we can embed it. We did go through a very thorough all-round people strategies changes from when people start from the recruitment stage, when they're on board, when they join, in the talent development and training, etc. So there will be all-round people strategies that we deployed. However, for these sessions today, I'm not going to go through everything that we have did in Signal. In particular, given our focus on health, well-being, I would like to particularly share with you the employee experience journey that we've gone through. So this is the whole person framework that we did deploy in Signal. The key words here is the human aspect of work. We want to provide a very thorough all-round well-being support to our staff, which actually resonated to all the survey respondents that we noticed from the market that people look for more support from their employer. So these are the 4 dimensions that I'm going to share more specific example later on in these sections so that you can take some references and see if any particular solutions that may be relevant to your organizations. Not everything is too difficult to achieve. Some of them are lower hanging fruits that you may actually do immediately back to your organizations. So before I give you more specific examples in each of these dimensions, I'm really keen to share with you that what have been changing. I think without doubt, we all know that in the past 2 years with COVID-19, many things have changed. People mindset, their habits, their expectations, their everything have actually changed. Since the emergence of COVID-19 till the current situations having a COVID normal environment. So this slides, I want to focus in sharing with you in our observations through our people engagement survey, through the focus group that I've been talking to staff, even all the interaction with staff. These are some of the dimensions that I can conclude in here. So people have been reassessing their priorities. People have been thinking what matters to them now. So these are what matters to them. Firstly, I want to focus on the emergence of well-being-centric culture. So the priorities have reset. Currently, people have so much focus about their health and well-being. So there is an emergence of well-being-centric culture. When people choose to join a company, when they take a job, it's not just the salaries or bonus that matters. It's whether there is a well-being coverage to the individuals, whether that company actually embrace a well-being-centric culture. So that's first. The second thing that we have noticed is people now look for meaning, fulfillment in their jobs. They want to have a shared identity with the companies. They are very mindful about what is the company purpose. Do they have a shared values? Whether the company is doing anything meaningful to the societies. So that's the second one. Third point downstairs, sincere, authentic. Like I think the staff now talk a lot in terms of are you walking the talk? If you are telling me that you value staff members, employees is your most valuable access, if you are telling me that your organization is creating changes to the society, you're doing good to the environment, the staff will then ask, do you actually walk the talk? How genuine are you? If you're telling me you care your employees, then do you have all these facilitations in terms of your people policies? Do you provide a good well-being culture, provide healthcare coverage? Do you care me as an individual? So all the staff now talking about you need to be genuine about what you're pitching. Then another columns here is employee experience. So again, with all of you in the room or online, I'm sure you are very clear of how important customer experience journey is. So you care your customers, however, the journey is actually the generations that you need to care about your employees. Your employee experience is equally as important as your customer experience, if not more. So what does customer and what does employee experience means, right? It simply means the user experience of your employee. It's the intersections of your employee expectations, the work environments that you're creating, and all the supports and events, the experience that your staff have in your organizations. So investing time to develop a great employee experience journey to us is extremely important because it's exactly telling your staff that you not only care about your customers, you care about your employees as well. Then the green box up there is flexibilities. So this one is very easy to understand that you indicate in the poll area as well that people look for flexibilities. There's no longer a one-size-fits-all approach. You don't provide the same solutions to your customers. Likewise, you don't provide one HR solutions practice process to your employees. So you need to provide flexibilities. Flexibilities is not just about flexible work arrangement, flexible working hours. It could be about flexible employment arrangement. In fact, given COVID or given how people used to remote working flexibility, some people actually quit their full-time job, particularly look for part-time arrangements so that they got more time to work, to pursue their goal, to look after their family. So it is actually quite a phenomenon. And in terms of flexibilities, it's not just about working hours, locations, or employment patterns. It's also about how to get jobs done. So maybe it's time to have a reflections in terms of your companies, how decision is actually made. Are there any flexibilities there, or everything needs to go through your approval? Do they need to actually go through hurdles meetings to actually get things done? Or would there be a more flexible approach so that people doesn't need to spend too much time on unnecessary things? So that's another thing. And then lastly, simplicity, transparencies, and technologies is something that matters to employees now. I think this one is very simple to understand as well. With the digital age, people experience convenience across all aspects of their life. They order food, movie ticket, flight ticket, everything through an app. Likewise, your staff actually look for the same simple support from you. So do you need to actually, when they get things done, do you actually deploy technology in your companies, or you're still going through very clumsy administrative process? That's another question that we need to have. And the second point is transparencies, right? So now the staff look for something really transparent. They don't really want to go through book of policies or go through HR to ask for advice. They want a platform, online, clear, straightforward. They can look at their benefit entitlements, look at all the coverage directly. So something quick, simple, technology-based is what the staff are looking for. So now, this is a summary of what we have noticed, especially in the past 2 years: well-being, shared identity, meaning, flexibilities, employee experience is all in the staff mind. So now I can share a bit more in terms of Cigna that we did. We manage, we provide all-rounded well-being support, and we look at people across the health, mental well-being, social, and also intellectual dimensions. Now I'm going to share with you some of the measures that we have deployed in the past 2 years so that maybe you can take reference or share with me some of your experience as well. So firstly, the first dimension is healthy. So again, very straightforward. People now look for a peace of mind. They want to make sure that they are covered, their family members, and looking after. And as an employer, we are keen to make sure that our employee would actually experience the same services like our customers, so that they are actually in the top priority rank as well. So I provide quite a number of examples in here. The first one, healthcare plan, which again is something that is really deep in Cigna's heart, that we genuinely believe that providing a comprehensive healthcare plan to our staff would actually make a difference. And in terms of healthcare, it's actually very wide. It could have inpatient, outpatient, hospital cash, dental, mental, etc. So there are a wide range of healthcare coverage that we actually did provide to our staff members. And the point is not just staff members. We actually extend to staff families so that the peace of mind is actually extended. The second thing is the first in market experience. So again, I mentioned earlier that we're so keen to make sure that our staff member actually buy into our values, they buy into our missions, right? And also we want to make sure that they are engaged in the whole process when we launch anything to our customers. So Cigna actually have the first in market experience in telehealth. Telehealth meaning you can do virtual consultation, you see a doctor through videos, and then you get the medications delivered to your home, door to door. You don't need to really go through the long time consuming queues in the clinic. So we actually pilot the telehealth first in our staff members, and then we extend to the external market. Another one I really want to highlight here is care manager services that we actually provide to our staff members. So you may recall I mentioned earlier when I said that we developed a healthcare culture in Cigna, I did actually employ quite a number of registered nurses and doctors, right? They are not just providing support to our external customers, they're actually providing support to my in-house staff member as well. So it could be as simple as you got flu, simple symptoms that our staff can actually approach care managers so that they can get direct advice. Or it could even be the situations that the staff unfortunately got critical illnesses, or even the family members got critical illnesses. Actually, these care managers provide advice and support to our staff members as well. And also, again, technologies is what we provide to our staff members. So as you see, we got the apps, we got like 24 hours chatbots, e-claims, everything on the digital panels that the staff can experience easily. And again, of course, there are all these ongoing activities. We actually provide a health day, health risk assessment, etc. to our staff members. Health day would be like a day and afternoons that we have different booths, and then we got the specialist doctor of different fields. They come in and provide consultations to our staff member so that they can experience what we actually provide to the customers. So that's first. Healthy is the most important piece. Oh, by the way, you may actually ask like why everything got the hashtag and stay there, right? Stay healthy, stay at ease. Actually, what does it mean? So it actually reflects how we revamp our strategies in the past 2 years. Actually, last year, most of our staff members actually worked from home full-time given the COVID-19 situation. So we did actually have this campaign with the hashtag stay, meaning they are stay at home despite their stay at home, but we're still connecting as a company, as an individuals, and as a staff member. So hence, like everything got stayed there. Then other than staying healthy, I would like to share with you stay at ease. Stay at ease meaning the mental well-being. That is particularly important to many staff members these days. So the first one I want to share with you, which maybe may not be that important now given COVID-19 is relatively under control, but just for sharing, we did provide 10 days emergency time off for colleagues to take leave. Anything related to COVID-19, be it they want to take a vaccinations, they want to recover from the side effect, they need to take care of their family members, like anyone like unfortunately got affected by COVID-19, they can utilize these 10-day paid holidays to handle their needs. We did provide quite a number of health talks so that like we just provide peace of mind to colleagues so that they understand the implications of taking vaccine, is there something suitable to them, etc. Of course, we did provide quite a number of income protection products or even financial aid for people who actually got impacted for COVID-19. Again, it all correlates to what we said earlier, that people are stressed, they need support. Financial is one of the things that they are very worried as well. So other than the COVID-19 support, there are something I think like you may find it useful as well, which is the Employee Assistance Program, which is we provide 24 hours support on counseling service. So it's a hotline that all staff members and their family members can actually call if they need any assistance in terms of their mental well-being. Also, we did provide quite a number of wellness workshops to our staff members. It's all supported and sponsored by the companies. For example, the mental health first aid certificate, and also we focus quite a lot in terms of resilience, stress, and anger management. When we first actually introduced this program on anger management, people actually have a laugh and say like, why did you impose something? Is it like everyone is so being so angry and can't control yourself? But then again, it's a bit education. So we want to promote that mental well-being, be it stress, anger management, there's nothing shameful to talk about it. It's applied to everyone. Everyone could actually take good lessons from it. So So at the end, we actually receive like loads and loads of very positive feedback that be it your parents, you want to handle your kid, you want to handle your husband, and like our colleagues actually find this anger management workshop very, very useful. Then lastly, like there are two things that, again, I think many companies can actually try as well, which is the well-being check-ins. So I think in the audience, if any audience in the room being HR, they would know in the past we talk about performance management approach. You need to talk to your staff, give a performance rating, have a chat like on a yearly term, etc. In recent years, we've introduced check-ins. Check-ins meaning that you don't need to wait till end of the year. You can talk to your staff as and when needed, as frequent as possible, so that like you guys maintain the connections, maintain the directions of the organizations. So check-ins, we particularly introduced that check-ins is not just about work. It's not just about, as a manager, I want to know to what extent you did complete your task. We introduced this check-in is about well-being. We purposely want the managers and talk to the staff, simply ask, how are you doing? Are you coping okay? Anything I need to support you? Just a few questions that we want to highlight that every single step is actually matters. Every simple greeting actually matters. And lastly is something like very well received in Cigna at least that maybe you all would enjoy as well, which is no meeting Friday afternoons. So again, people used to do happy hours on Friday, right? But then given COVID, there are limited opportunities that people go out and restaurant bars actually close early hours. So we introduced this no meeting Friday afternoon. So at least, even you don't have happy hours, but at least you're free in that afternoon. Of course, by saying free doesn't mean that you can simply take a holiday in the afternoon. It simply means there will be no meeting. Management team wouldn't call any meetings on a Friday afternoon. You can take your time, take a pause, handle your task over a quiet Friday afternoon so that, again, everything we want to do is to give a peace of mind to our staff members. Then moving on, I want to share some other examples as well on the other two dimensions. Stay connected. I think the focus here is how to strengthen the relation ties with the staff members. Again, traditionally, the relationship may be a bit transactional, that I give you a handsome paycheck, I give you a decent bonus, you work for me. This is rather transactional, right? But what we are trying to do here, and we notice what employees are actually looking for, is the relationship. Relationship is something that they have been missing in the past 2 years, especially for organizations that have adopted remote working. So Cigna, again, we have been testing out many solutions to see like what are some of the approaches that was fit for our organizations. So now we have adopted this hybrid work arrangement approach. Last year when COVID was really intense, we were very extreme. We asked all the staff members to actually work from home almost a year because in our mind, it's all about well-being and safety and everything. So for this year in 2021, we actually adopt this hybrid work arrangement, meaning it's your choice. You can choose to stay at home to work, or you can choose to come back to the office because we do see actually there are myriad of both options. Some people actually want to work from home, but some people actually want to work in the office. There may be important occasions, important meetings that they want to see the colleagues. There will be team bonding that we'll want to maintain in the office. So what we are providing now is a hybrid work arrangement for flexibilities and also for reintegrations. Secondly, we provide different kinds of wellness and family-friendly leave. Again, we believe the relation is not just about an employee with the employer, it's about the family members as well. So hence we provide quite a wide ranges of family-friendly leave arrangement. So the best things here is we're not discriminating the fathers, so we actually got 4 weeks paternity leave for that. We also got adoption leave, family, emergency leave, etc. that we want to cover all around the support to our staff members. The fourth thing is more about recognitions. So again, why I particularly want to talk about recognitions, right? I think in most of the organization, it seems very normal that you will recognize your staff members. But sometimes we may be too used to it, we may be take it for granted, so we notice that we need to do it intentionally. Hence, we actually provide quite a lot of platforms for our staff members to see how to recognize them in the most instant way. So we do have all these surprise perks. We have actually surprise arrangement to distribute ice cream, distribute chocolate to staff whenever we got anything that worth celebrations. And of course, there are different types of on-site engagement that we did arrange. Recently, we have this Friday get-together. So again, Friday, relatively relaxing, so we actually order lunch for our staff members. As long as they want to join on a Friday, then the management team will be in our pantries, chit-chatting with the colleagues, just to talk about anything casual. So the whole purpose is to build the relational ties. Then the last segment that we noticed. So we talked about health, mental well-being, connectivities. I think the last thing, which is about learning. Despite it's a COVID situations, but we notice actually people are still very keen to develop their personal and professional goals, career achievement, etc. So even in the COVID situations, we think we shouldn't lose sight in terms of supporting our staff for professional development. So the first one, of course, like leveraging our health expert in the organizations. We did provide quite a number of wellness and vaccinations, health talks, and we provide loads of tips in terms of how to maintain health, personal protections, even parenting and caregiving. Why parenting is important? If any parents in the room, you probably would agree with me that last year, you spend 24 hours with your kids at home, that you probably appreciate some parenting tips to see how to manage your family in a harmonious manner, right? So this is actually a topic that our staff look for support when we did do quite a lot of research and try to provide some tips and workshop to our parents, the working parents. Then we have this Signal University. Of course, it's not a physical university. It's actually an online learning platform that we provide numerous courses online. We actually sponsor different certificate courses so that our staff members can go to the platform, take whatever courses that they find it useful for their career at the pace that they want, because it's an online platform, right? They can do it anytime that they like. And of course, we did something relatively traditional. So we do have educational support for people who are actually pursuing a degree program. Then we will actually sponsor them to do a degree program. And I think one thing is a really big selling point is that we don't need staff to sign any undertaking documents. So meaning we don't really want them to commit, if I sponsor you, you need to stay with Cigna for X number of years. We are very genuine that it's for your career development. So no sort of tied commitment that you need to provide to us. Okay? Then, of course, there are different wider departmental sharings to ensure that all the staff members know each other, especially returning from COVID situations, from the remote working. So we do lots of these departmental sharing to ensure that the staff members can keep learning what is happening across the organizations. So these are just some of the photos to prove what I said is genuine, that we got all these lovely faces from the staff members. And you see that everything we do, again, there are loads of options in the market that you can adopt and loads of people's strategies. For Cigna, very particular, our goal is very clear. It's a wellness-centric culture that we want to build. So all the activities that we are organizing is wellness focused. So we have the yoga class, music therapies, health day, family day, everything is all about wellness. So hence, and also we learned that after COVID last year, people are actually cherishing all these personal interactions. We used to, at some point, we need to encourage people to join these activities, but now returning from COVID, we notice that people just naturally being so enthusiastic. Whenever we organize any on-site activities, people just generally, they want to join. They want some team bonding together. So I've now shared what I did in Cigna, what are some of the people-centric initiatives that we have adopted. Again, back to the topic today is that we mentioned staff engagement is important, employee retention is important. I think it may be worthwhile that I share with you some of the healthcare provisions that Cigna could provide. And again, I'm not here to tell you what are some of the healthcare provisions that will be suitable for your organizations. However, I've picked a few items that we got particularly good feedback from our own staff members. So as a staff, they did enjoy these services and they find it very meaningful, be it to themselves or to their family members. So just to highlight a few, then you can see whether it's something would be meaningful to your organization as well. So first of all is the health and wellness services. It's not just about a medical insurance plan. It's not just about when you get sick, you get a claims and go to the medical insurer. It's all about total health care and all-rounder support. So as I said earlier, we have a group of Insight health specialists. So we have wellness consultant to actually provide you advice on how to organize activities that are relevant to people's well-being. And also we have this employee assistance program, which was found particularly useful because the employee assistance program was actually provided by an independent third party. So nothing will be disclosed to HR. You know, in a larger organizations, people are very mindful whether things will then go back to HR. Again, hand on heart, we know nothing. It's all confidential because it's all provided externally. So this is something like the staff members and also the family members particularly enjoy. Second one is about the care managers. So again, I did mention earlier that we do provide case managers and care manager services. So when you have any particular critical illness or you simply want a second opinions about your health situations, the care managers is here to support you. Lastly, in terms of medical provider network, of course, we did provide a very high quality medical providers across Hong Kong. I think what is worth mentioning is really the telehealth services. So this slide is more to recap what a particular telehealth services is about. Simply put, you don't need to go to the clinic physically. You just need to download the app. Then you can book a doctor online, and then you can consult a doctor virtually through videos. And also, it provides the same-day medication. So many people actually got that myth is that like when you consult a doctor virtually, you couldn't get medications, you need to go back to the clinic, right? So actually, they do provide medication delivery to your home so that you don't need to physically go to a clinic. And also, it would be a cashless arrangement. And also, they do referral letters as well, even sick leave certificate. So again, it's something the staff member initially sort of asked like whether virtual doctors could provide sick leave certificate. It's all included. So I think it's worth mentioning. And lastly, we mentioned earlier that technology is important. People look for something simple, something digital, online, right? So this is one of the services that our staff actually enjoy as well, which is a chatbot. It's a 24-hour chatbot that people can look for a doctor, make a booking, check their claim status, and even like look for health and wellness tips. So it's something, again, is something our staff members really, really enjoy. So to conclude, I think I have a video that are just 1 minute, which can actually explain what the care manager's service is about. The reason I particularly want to introduce to you because like our staff member actually tried that, and unfortunately that staff member actually got critical illness, and the person actually tried that service, and they're really, really thankful and think it's really deep into their heart. And we have this video. The video is from a genuine client that also experience an accident and also talk about how the care managers actually provide support. So I think it would be quite useful to share with you all.
It should be cashless hospitalization. All I need to do is bring Cigna's medical card along with Faye. And I was able to do so quite easily. Their services are comprehensive. It's so crucial to support the physical and emotional needs. They're both very important, and I don't think that other insurance companies can do this. The care manager then explained that I would need to attend a few sessions of physiotherapy after my surgery was completed. She also told me about the services I would get from Cigna once discharged. As a patient, her messages made me feel relieved.
Yeah, so actually there's a real client, and then she actually got an accident, she broke her leg, couldn't walk, and then they call our care manager services, and then our care managers actually met with her, visit doctor with her, refer physiotherapist with her, and provide all this mental well-being support to her. So again, this is the care manager services that actually our staff member really valued. So I guess like after going through all the services that we have and my experience in Cigna, I think just to quickly conclude, I think a few key messages here, right? COVID definitely have changed how people see things. We noticed that employees have been reassessing their priorities. It's not just about money. It's about whether they fulfill any personal meaning, whether the company actually walk the talk, whether the company actually look after the well-being of the employees. So people are just reassessing their priorities. And then you see from the Cigna 360 well-being surveys that people, for sure, look for more support from their employers. So again, it's a gap that maybe you can fill to provide some additional support to your staff members. And also, what I've mentioned just now is just what we did experience in Cigna. Maybe your organization's got something different or you've got something different, it's got different needs, right? I think our sharing is really about the employee experience, so try to listen and think through from the employee's perspective. Whatever measures that you're going to deploy later on, I'm sure that it's all for good cause. But after all is try to listen to employees and try to think through from their angles. Then everything you do will be quite meaningful. I guess lastly, the last point is really, despite the whole section is about employees, you guys as an entrepreneurs, you need support as well. So don't try to resolve everything by yourself. We're not expecting everything from the employer as well. It's a journey, it's a partnership together. Hence, we think like listen to employees and co-create a solution is actually very important. And of course, for healthcare, there are lots of options in the market. So hopefully you may find something that will be relevant to you all. Thank you. So I think we can take some questions, right? Or okay, just give me one quick second to go through the questions. Okay. So let me try to take a few. So the first question is, do I think an all-round insurance coverage is an attraction to staff retention? For sure, definitely. I think like insurance coverage, again, in Cigna, we try not to just say insurance coverage. Hopefully, after hearing what I say, it's not just about insurance. It's about the total healthcare provisions. It's about physical, mental well-being, and you don't come to Cigna only when you need to make a claims. There are all these wellness supports that could be provided to you. So again, like definitely a healthcare coverage would definitely be an attraction to the staff members. I think like as HR, I can share more, which is when I interview different candidates, definitely in the past, like people don't ask that many questions about medical coverage. But in these recent years, I think like many candidates actually want to know more about the coverage as well. And given, especially in Cigna, we don't really hire fresh graduates, we mostly hire professionals, right? So they have the experience in different companies, they know the coverage, the medical coverage in different companies, and they are definitely very keen to compare what different companies can provide it. So I think it would be quite useful you actually provide a comprehensive insurance coverage to your colleagues. I think another question that probably you guys may have in mind as well is, as a startup, how do you support such a comprehensive insurance coverage, wellness coverage under a rather limited budget, right? I actually asked this question to my sales team before I come here because I think this is the #1 question that you have in mind. I think what I understand is actually there are different solutions in the market, and you can pick and choose what are some of the core elements to you. You can either choose it's just for inpatient, you can either choose just for clinic visit, or simply mental well-being service. So it all depends like what are your needs, and what perfect is they can offer a tailor-made solution based on your needs. So you can tell us your budget, and then we can pick and choose what is relevant to you. And also, like, I think one of the questions is actually from a startup employees. They're saying that they're very happy, excited to see like some of these benefits that Cigna provided, but they think that it all depends on whether their boss would take it or not. I think, again, it's very true, right? You're running an organization. You need to balance your business. You've got so many priorities that you need to handle. You've got a cost constraint, everything. But then I think it all depends what is your longer-term purpose. What do do you actually value your employees? If you value your employees, do you actually talk to them? If you talk to them, you can actually try to understand what are some of the most critical support that they're supporting. I think many people, again, because I did interview quite a lot of candidates from startup changing to corporate, and likewise from corporate, I lose quite a number of talents to startup as well. So I think like when people join your company, join a startup, they join you for a reason. It's not just about the benefits that you provide. So I think it's really the journeys, right? You talk to your staff, you listen to them, and then you just honestly let them know to what extent you can provide certain level of support. But some support, it may be a journey, it may take some time. So I think, again, is a discussion, and then is a solutions that co-create by you guys. But I think one point in here is important, and why I particularly want to highlight again is I'm not expecting employers to do everything, to resolve everything for the individuals. You got your parties, your constraint as well. But I think you are a role model to your companies, and you are the source of support to your company. So if you show them that you care about your physical health and your own mental well-being, actually the staff would feel it. They could know that you're actually walking the talk. So I think just to create an open cultures for people to talk to you, and you can be genuine and engage the staff on the journey, I think that would be helpful. And just to, actually there are quite a lot of questions. Hold on, I try not to repeat myself. Oh, actually someone asked like which companies actually offer such a thorough support, and probably some of your staff that they want to join me. Again, like for sure, after I've seen everything, Cigna did provide all different support as well. But of course, I need to be honest, it's not just about Cigna. Like quite a number of companies actually know the importance of employee engagement and also employee retention. So again, it is getting traction in the market. So it's about time for you to start doing something if currently you don't really have any. Yeah. That's a good one. There's a question asked like, do we have any evidence that after deploying all this, it can really help with my staff retention? Yeah, that's a good one. So we actually did employee engagement survey every year. Particularly in the past 2 years, we actually do it twice to 3 times a year to timely measure the staff response to gauge whether they are enjoying themselves, what are they concerned, etc. So after deploying all these, we compare the result before COVID and post-COVID or COVID normal. We noticed that we're very, very honored that actually the staff engagement results have been increasing before and post-COVID. So meaning all the negativities, adversity as driven by COVID didn't really affect our staff member much. So it actually supports as an evidence that like after deploying all these, our staff members, the health and mental well-being are actually sustaining in quite good levels. And of course, like another evidence, which is we did actually conduct quite a number of exit interviews when people leave. Very interesting. I'm not saying like after employing all this, your staff wouldn't leave you. People would still leave you for certain reason. But every time when we talk to the staff members, when they come back and tell HR why they're leaving, everyone is extremely thankful for everything that we have done to our staff members. And what they are saying is, even if I'm joining other companies, the values that we have created and all the well-being support that we have provided to them is actually deep in their mind, that they will actually refer people to come to us as well. So again, there's no magical solutions after you do this and that, and then people wouldn't leave. And to be realistic, in the Hong Kong situations, the job market is really active now, and there are loads of options in the market. So you just need to do something, otherwise you'll be quite behind from what your competitors are doing. Okay. So I think that's another, maybe just last 2 questions so that I can give you some of your time back. One of them are saying they only got 5 members into the company. So they are saying that it's a common not to provide any medical insurance. So yes, it may be the case in the past that when you only got a few staff members, you don't provide medical insurance, but actually the market got different solutions for you. Take Cigna as an example. even you got 3 staff members, we can actually provide plan for you, a medical plan for you that suits your budget. So even 3 members in your company, you can actually arrange something. Even you have less than 3 members, there are different individual medical plans that may be suitable for you. And again, even it may be common that in the past people don't provide medical insurance for smaller companies, but the trend has been changing. As what we have gone through now, people do expect medical healthcare provisions. Even the coverage may not be as comprehensive as what I provided just now, but you can pick and choose what are some of the core elements for you. So I'm sure that you actually may find something, even your company is small. Okay, so last one. Okay, I promised last question. So last question is, out of everything that we have done so far, the wellness-centric program, which program actually received a huge take-up rate, and what program are less popular? I think it actually surprised us that the Health Day actually got a very good take-up rate, right? You see, from all different activities here, we got the Health Day. So again, Health Day is we got different booths and different health specialists to do different health check, body check, pulse check with our staff members. Previously, we thought that Hong Kong people may be a bit shy. They don't want to disclose their health situations to others. They just want to hide themselves in terms of their health situations. So we noticed the Health Day, we actually got exciting sort of response, people queue up and they look for specialists. So the feedback we're saying is the Health Day actually draw their awareness. Yes, maybe in the past they wouldn't particularly go for a health check because they think it's expensive, it's costly. But given we have all these on-site arrangements, people feel that it's convenient, and people trust us that we are the health specialists. They trust our respect to all these health confidentialities, etc. And hence they just open up themselves and enjoy the Health Day. So I think this one is actually quite good because Health Day is not something you can easily find in other organizations. But again, it's something our wellness consultant could provide. Anything that's less popular, I can't recall particular anything is less popular, but the virtual solution, anything that's our virtual solution, at least in Cigna experience, it's definitely less popular. Because last year in COVID situation, we tried to organize quite a lot of activities, right? You see that coffee break with CEO, you see a screen there. It's actually some people dial in as a virtual solutions because we want to make sure that some people come on site and some people can work virtually. Anything that's virtual is less popular. But again, I'm not saying virtual solution is not effective. It could be something Cigna we need to learn how to even attract more people to join the virtual solutions because we really want to demonstrate both on-site and virtual solutions are equally okay. So I think maybe virtual solution is something that we need to work on. I think that's it. There's only 1 minute left. Shall I conclude the session?
Thank you, Christy, for your wonderful sharing. Please be